Hello everybody, happy Tuesday. So I thought I'd show you another chemotherapy just so you guys can see one of my other fabulous patients that we have going through. We're going to go into the chemo room and see Fudge finish up his chemotherapy. So here we go. This is our dedicated chemotherapy room. It's just a nice quiet place away from the hustle and bustle of the hospital. I guess our hospital is not too hustling and bustling right now, but that's okay. Hi Team Oncology. All right, so this is Fudge. Not only is he handsome and adorable, he has the best name and makes me want to eat fudge every time I say your name. Hi, Fudge. I'm going to try not to get you too super excited while you get chemotherapy. Today, giving chemotherapy, we always have Sonia. Always Sonia. Sonia is our assistant extraordinaire. She's fabulous. She is, I know, Fudge's like, I don't even need any restraint. No. Such a good boy. He just needs some loving. So he's not sedated. He's just hanging out. He's enjoying the loving and the attention. He's not barking. You were barking before. As long as you're getting love and attention, he's good. And today's chemotherapy nurse is Rebecca, who loves being on the camera. Thank you, Rebecca. Rebecca lets us come into the room even though she is not super fantastically happy with me when I make her be recorded. So everybody say thank you, Rebecca. So you can't see actually from this angle, but Fudge is actually what we call a tripod. So he only has 3 legs because he had bone cancer, osteosarcoma in his right back leg, as I'm looking at him and figuring out which leg is no longer there. So this is his second chemotherapy treatment. The drug of choice for osteosarcoma, you're on your flush now, right? Yep. Is carboplatin, and that was that large syringe, so it's a pretty large volume given over about 15 minutes. What was his dose? Was probably 30 mLs? Yeah. About 30 mLs, a little over 300 milligrams, so, and that's given over about 10-15 minutes through a catheter in his leg. This is a pretty well-tolerated chemotherapy drug. It doesn't cause a lot of irritation if it got outside the leg, like some of the other drugs like doxorubicin that we give. Doesn't tend to cause too much nausea, but it can cause a low white blood cell count, but not for Mr. Fudge. The first time that we gave chemo, he had a white blood cell count done by his regular vet, and his white blood cell count was perfect. So you don't need any antibiotics this time, and you don't need any extra appointments, and we'll just see you back in 3 weeks. What are you doing? All right, so that's the just stuff to get the adhesive off. So to make his. It was a little cold. Yeah, because I didn't like that. So this was, like I said, his second of 6 planned chemotherapies. We do that every 3 weeks, so it's not too crazy of a schedule. Oh, you're mad now? What do you think? You're so handsome. He's a little bit camera shy. He really had no side effects from his first chemotherapy. Most owners are so surprised that 80% of dogs and cats have no side effects from chemotherapy. I think his worst side effect is taking out his catheter. Yeah. So I'll tell you a little bit about his cancer. He was diagnosed with bone cancer. We see that cancer about 5% of dogs, so it's unfortunately relatively common. It is typically seen in large and giant breed dogs. And he actually had a very unusual, so that part he's pretty classic. We usually see it in middle-aged and older dogs. But his location was a little bit unusual. Typically we see it in the long bones above the ankle and the wrist joints, and his was actually in a bone called the metatarsal, which is part of the ankle joint or the hock. One of the, actually not even the joint, it's of the, I can show you on his other back leg which one it was. So it's the metatarsal. Sorry, you're pink today. You're pink. He's comfortable in his masculinity. Yay. So the typical places that we see osteosarcoma, we say towards the knee and away from the elbow, so the shoulder, the carpus, which is the wrist in dogs. There you go. And then towards the knees, so the bottom of the femur bone and the top of the tibia. Do we have any treats for you? Where are they? Where are your treats? Who's all done? Yeah? Such a good boy. Go on. And as you can see, he gets around great as a three-legged dog. No treats for you?
He doesn't want my treats.
He doesn't want treats. We got the good stuff down at the end of the hall. You ready to go? All right, so that's it. That's Fudge getting his chemotherapy for his osteosarcoma. Again, I can just show you the bone that he actually had it in on the other leg is one of these bones. So they're called the metatarsal bone. He's healing up really nicely. His hair coat's starting to grow back in, and he is getting around fine as a tripod. All right, you ready to go for a walk? Let's get you some good treats. All right. Bye, Fudge. Good boy.